let's talk about round ligament pain. So what is round ligament pain? Well, it's because there is a ligament that connects from the uterus all the way down into the hip. So as belly is growing, that ligament can get a lot more tug on it, which can be painful for a lot of women during pregnancy. So there's a couple things that we can do to really help get rid of that pain. And I'm a firm believer, and I see this with a lot of women who learn how to effectively strengthen their deep core, that once you become stronger in the deep core, that pain can go away. But there's a couple pieces that we need to do in order to help mitigate that pain. And so one of those is to learn how to release and relax that belly. So some things we need to watch out for is, so Caitlin, go ahead and come over here and just kind of stand to the side, is we want to watch out and make sure we're not doing that like clenching of the glutes. So do that like clench of the glutes and like notice how that kind of tucks the pelvis a little bit. So that right there, if we're clenching and tightening the glutes, can cause way too much restriction through the pelvic floor, which can then contribute to basically a dysfunctional deep core. So we want to work on optimal function. Okay, you can go ahead and kind of turn back. So we also, with the round ligament, one thing we want to make sure of is we're not gripping in the obliques. So some indications that could indicate that you're gripping in the obliques is seeing that kind of coning of the belly. So remember with our belly, anytime we're doing any sort of exercises or we're even getting up from bed, we want to make sure that our belly is nice and rounded like this and we don't get that little like kind of coning that can happen up through the middle of the belly. And if that's happening, it can just indicate that we're getting a little too weak through the front of the belly because we're gripping on the sides in those obliques. And if we're gripping in the glutes and we're gripping in the obliques, that's working against our deep core. So we want to work on releasing and relaxing those areas, just even paying attention during the day. If you or an instructor watching this, a client, is gripping those glutes, it's just starting to think about relaxing those glutes a little bit more. Then we also want to make sure any sort of movement we're doing, like if you're sitting on a couch or you're getting up and down from the ground, is making sure that you go from your side to your back to lay down, and then when you're on your back, you roll to your side to get up. Because if we are constantly doing that, a lot of that flexion motion, that not only can contribute to worsening diastasis recti, but it also can contribute to that gripping in the obliques and causing more space and just more gripping and grabbing in the ligaments and things.